to our forum today. Our focus is on leveraging rehabilitation to improve patient flow and quality outcomes in Southeast. And while we'll be looking at stroke as a model because we have that data available, this is really about rehabilitation as a potential solution for our ED-ALC crisis. My first task is to thank our very dedicated and committed planning committee for this day. A lot of work has gone into this day, and as you can see from this extensive list, I don't have the time to go through name by name, but I ask you to refer to your package because the list is there, and all of these people have brought their expertise to the table to make for an excellent day. I'd also like to thank Caryn Gill, the chair of our Regional Stroke Steering Committee. With her advocacy and support, has been able to facilitate this day as well. Most importantly, I need to thank all of you, because without your presence here today, this planning couldn't be possible. We have excellent representation, and I believe we have somewhere posted a guest list, basically showing you who's here today. We have executive from hospital and CCAC, including CEOs, CNEs, VPs, Board of Governor membership, hospital, CCAC, and community provider directors and managers, as well as physicians, and representation, managers, clinical leadership, and administration roles here today. So have a look at that guest list, and hopefully you have an opportunity to do a little networking today. So why are you here today? Why have we asked you to join us? We do have an urgent platform. That is, we have a crisis with patient flow. Our ALC rates are high in Southeast. So we're at this tipping point. We're trying to balance finances with quality patient care, and we do know that hospitals are under financial crisis. What we also know, or maybe some of us know, and some of this might be new information, is that rehabilitation has the potential to impact that ED-ALC crisis. A lot of great work has been done at local, regional, and organizational levels, both around best practice for rehabilitation, as well as for patient flow initiatives. And those successes need to be grown, basically. We can't work in silos to affect the bigger system change. A lot of local level work has happened, but we need to continue to work together. The crisis basically still exists, so we need that cross-continuum, regional, and holistic approach. So, why are we here today? We want to look at rehab as a potential solution, identifying opportunities to leverage rehab to improve patient flow and outcomes, and to establish the development and work towards a rehabilitation plan for our region. And of course, the ultimate objective is improving patient flow, maximizing quality outcomes, and reducing healthcare spending. So I'll give you a bit of background as to why we're here, why the time is right. We know that the Ministry of Health and Long-Term Care was seeking expert advice around how to solve the ED-ALC issue. And one of the panels included a rehab and complex continuing care panel who, with the input of a stroke reference group, identified for the ministry 3 top priority rehab best practice recommendations that would have the greatest impact and potential for solving or supporting the ED-ALC crisis. We also, from that information and that input, provincial economic analysis was conducted, and there was a potential for $20 million to be saved, well, reallocated for resources through that provincial analysis, if best practices are applied. We also have another motivator in that in 2013-14, the ministry will be bringing forward quality-based funding, and this funding is for stroke care to incent hospital best practices. And this is not only happening at an inpatient acute level, but also inpatient rehabilitation level. And finally, there's a rehabilitative care alliance that's being formed to translate knowledge across our LHINs in the province. We certainly know that there's a lot of variability in standards and access to rehab provincially. And this alliance will help standardize that rehabilitation and look to improve fiscal efficiencies and greater access to service and standardize that service, as well as promote knowledge translation. And this can be evidenced, of course, by some of the great work that's being done in other LHINs relative to these rehab priority recommendations, including the Central East LHIN and Waterloo Wellington. From a regional perspective, a lot of work has also been done. We see that our ALC data reflects certainly a crisis. We also see from our LHIN stroke report card that we have a rehab crisis. Our Regional Stroke Steering Committee has identified rehab, access to rehab as its top work plan priority. And from the perspective of this planning committee, we've done a lot of pre-work to look at what we need to focus in on today. So that work included a rehab gap analysis relative to the best practices. So what was happening across Southeast in comparison to that standard set by these three top priorities. Each of the organizations within the planning committee then prioritized those best practice recommendations relative to the organizations with the local level needs. We also actually looked to make sure that this truly aligned with all of the important initiatives that all the organizations are focused in on. And that includes alignment with the organization's respective strategic plans and quality improvement plans, as well as the LINS IHSP and the Restorative Care Clinical Services Roadmap. And finally, what's happened is we were able to retain the services of Matthew Myers to conduct a regional level economic analysis. So you'll hear from Matthew today around the positive impact applying these best practices and what they can do for the fiscal efficiencies in our area. So basically the stars have aligned and the time is right to look at rehabilitation as a solution. All of this is a lovely framework as a solution for EDALC. We're using stroke today as a model, but we're applying it generally to the broader picture. And this will help to inform our IHSP3 as well as the Restorative Care Clinical Services Roadmap. For any additional information as well, I'm rushing through the background, but there's further information in your handout within our newsletter on some of those initiatives. So today's agenda, we're here to understand the impact of rehab on best practices, both from a patient perspective and a system utilization perspective, patient flow, quality outcomes, and saving money. So Dr. Bailey's going to talk today about why rehab matters and how it can affect change, with an overview on those specific best practices. Dr. Puxey is going to review the Restorative Care Clinical Services Roadmap, specifically looking at how it does truly align with these rehab best practices. Dr. Bagg's then going to be looking at the current status of rehabilitation in Southeast using the stroke data to give a picture of what's happening here. And then we're going to hear from Dr. Dan Bouillard and Steve Pearson about their personal experiences, stroke survivors. Matthew Myers will then review the regional economic impact through his analysis, and then the afternoon is going to be invested in an interactive opportunity to look and validate those current roadblocks that we've identified, look at the contributing factors to the roadblocks, and then try to define some solutions to remove those roadblocks. And you're going to be called upon throughout the day to try to prioritize what 2 of these best practices of 7 you'd like to focus in on for that afternoon session. I'll explain those dots on the table in a moment. So this is just the beginning, of course. This is just the first planning day. There's a lot more that needs to go into this process, and that includes ongoing regional collaboration. So the idea is to inform our governing documents, our governing initiatives such as the Restorative Care Clinical Services Roadmap, but next step will involve ongoing regional collaboration to look at implementation at a local level. Is this feasible at your level in your area of the region, and looking at the resources and needs. And of course, the Stroke Network will be supporting the follow-up workshops at the local level across the region. I'm just going to orient you, you've obviously seen this a little bit already today. This is our graphic to demonstrate these best practice recommendations. They're aligned with the Restorative Care Roadmap and what those best practices actually look like and how we have identified their roadblocks relating. So we'll be referring back to this document throughout the day. So what you see here is the 3 priority recommendations: early access to rehab, intensification of rehab, and access to outpatient and community services. So embedded in those are the 7 specific best practice recommendations, including acute care, stroke unit care, early access to rehab, that is admission by 5-day and 7-day-a-week admission, regional standards for access to rehab, intensity of therapy, including 7-day-a-week therapy, 3 hours a day, and regional access to slow stream rehab, including triage, really defining what that looks like in terms of who should access less intense service and really defining the standards of that care. Looking at community day and rehab programs and equitable access to those services, as well as community linkages. So you'll see these boxes are the best practices. You'll also see corresponding diamonds on this graphic that basically reflect that we have roadblocks in each of these areas. The graphic also reflects some of the local, provincial, or regional level tools or resources or initiatives near that Go sign that represent some ways to help overcome some of our barriers. So that's the graphic in a nutshell. I'm going to ask that you refer to a green sheet in your package, and throughout the day, as you hear from the expertise of our speakers, this package will reflect some of your thoughts and ideas as you hear from our speakers around what are the contributing factors to these roadblocks and what would it take to remove these roadblocks. So please use that form as an opportunity to jot your ideas down, and it will help to facilitate the afternoon session. And those dots that I referred to on the table, if each of you could take 2 dots and apply it to the poster over here on this far wall, and choose your 2 top priorities that you want to rotate through in the afternoon sessions, which two of those best practices and roadblocks you want to focus on, and apply it to that poster, and that will just help us in terms of setting up the numbers for the tables for the afternoon. This is just another graphic I just wanted to orient you to, and that is a geographic map highlighting all of the roadblocks to these best practices. And it's just really to show that the dispersion of the challenges are right across our region. So that's what that's about.